Good morning. It's an honor to be speaking with you today, and on behalf of my co-authors, I'd like to thank the Scientific Committee for inviting us to present our work. I'd like to spend a few minutes speaking about experiences with the compulsory drug detention system among people who inject drugs in Bangkok. As I'm sure many of you are aware, Thailand has long been contending with a very serious epidemic of HIV infection among people who inject drugs. Notably, as this graph shows in the blue line, for several decades now, the prevalence of HIV in this population has remained between 30 and 50%. And this is despite the fact that Thailand has a rather effective system of HIV care and treatment, and also despite the fact that the country has made very significant progress in addressing HIV infection among other key affected populations, including sex workers and their clients. The failure to significantly address the epidemic among IDU can in part be attributed to Thailand's approach to drug policy, which is really characterized by a very aggressive law enforcement-based approach. For example, in 2003, under the state-sponsored war on drugs, it was estimated that there were almost 3,000 extrajudicial killings and over 50,000 people placed into compulsory drug detention in just a 3-month period. In response to widespread international criticism, the Thai government then created the Narcotic Rehabilitation Act, which reclassified people who use drugs as patients rather than criminals. And despite this change, they then also announced the creation of a system of compulsory drug detention centers, which they called rehabilitation centers, which were institutions for treatment under the penal code. And although people had been classified as patients, these centers were run by the Ministry of Justice, not the Ministry of Health. This was followed by a number of successive policy announcements, which involved making public announcements regarding commitments to enroll literally hundreds of thousands of people into compulsory drug detention, including one in 2003 that pledged to enroll 400,000 individuals. Many of these announcements involved the public shaming of individuals suspected of using drugs, such as in this photo. In 2008, there were an estimated 84 centers throughout Thailand. They operate under different models, including the FAST model, which emphasizes family, alternative activities such as music and gardening, self-help in the form of mostly physical training and therapeutic community work. The Jirasaw model is also very common. It's similar to FAST, but places a much greater emphasis on military boot camp style training, physical exercise, and Buddhist teachings. And in other words, there is a near total lack of evidence-based addiction treatment in these settings. And as they continue to grow throughout Thailand, there's been a really stunning lack of rigorous evaluation of the impacts of these centers. Although a number of field reports from human rights organizations have pointed to serious human rights violations within these centers, and again, a lack of evidence-based addiction treatment. Our team at the BC Centre for Excellence in HIV and AIDS has had the pleasure of working with the Thai AIDS Treatment Action Group, the Mit Sampan Harm Reduction Center, and investigators from Chulalongkorn University as we worked on the Mit Sampan Community Research Project, which is a serial cross-sectional mixed method study. It involved 32 former or active drug users who were trained as peer researchers and were involved in all stages of the project. We conducted 3 waves of surveying between 2008 and 2011, and we managed to reach over 700 IDU who were recruited through peer-based outreach and word of mouth. We also completed approximately 50 in-depth qualitative interviews with these individuals. Very early on, we started hearing a number of anecdotal reports of severe police misconduct in the community and from the community members, and we began to investigate this. And this is where we first got some indication of the links between police misconduct, abuse, and violence and this new system of compulsory drug detention. In this analysis, we found that 48% of our participants reported actually having illicit drugs planted on them by police prior to being arrested. And in a multivariate model, we found that having drugs planted on you by police was independently associated with having been exposed to the system of compulsory drug detention in Thailand. And this helped provide some evidence in support of claims that police were actually engaging in this form of misconduct in order to meet arrest quotas that were set by the government, and also to ensure that they were meeting the target for rates of admission into the system of compulsory detention. Thailand is also one of the first countries in the world to implement a system of random roadside urine testing for drugs. People will be literally pulled out of taxis and off motorcycles and asked to provide urine samples at roadside, and with sometimes confirmatory testing being undertaken at hospitals. In our sample, 63% of people reported being urine tested by police. And again, we found an independent association between having been exposed to the compulsory drug detention system and having been tested for drugs by police. There are also widespread concerns regarding extreme police violence against people who use drugs. And in this analysis led by Kana Hayashi, we found that 38% of our sample reported being beaten by police. And again, there was an association between having experienced police violence and been exposed to the system of compulsory detention. And the impacts of these types of police interventions and forms of misconduct on HIV risk behavior should not be underestimated. In this analysis, again, Kana Hayashi showed like a dose-dependent effect between intensity of policing exposure, violence, and urine testing, and syringe sharing. Experiences of violence and neglect in compulsory detention were also evident in our qualitative interviews. This individual said they did not provide any therapy, they just brought us into an environment that was like torture. As soon as they arrived, they shoved us and kicked us behind bars and left us there without doing anything. I suffered withdrawal symptoms, I couldn't sleep, couldn't eat, and threw up whatever I ate. This individual said, I told them I was HIV positive and had a doctor's letter. They just didn't listen. They didn't try to contact my relatives, even though they knew I was sick. I needed medicine and had to see a doctor, yet they just didn't care. We also looked at the impact of compulsory drug detention on intensity of drug use. And we found that among the 40% of the sample that had been in compulsory drug detention, 96% reported active injecting in the past week, and we found no statistically detectable differences in the recent intensity of drug use among those who had and those who had not been exposed to the system of compulsory detention. And these impacts were described by one individual who was asked whether being in compulsory detention impacted his drug use. He said, I think it has any impact on me, it doesn't affect me. Actually, I think for younger people, they could use even more heavily. I used to be like that too. I was in prison for a long time. When I got out, I just released that pressure through a big hit. Things can go so wrong. People can just turn to do bad things, just go to the extreme. It's a way to push back. We also have been concerned about the fact that we were hearing from a number of people that they were actively avoiding healthcare altogether, including HIV and hepatitis C testing. And in this analysis, 25% of the sample said that they were actively avoiding all health care. And then again, in a multivariate model, we found that having been exposed to the compulsory drug detention system was independently associated with reports of avoiding health care. We've also had an opportunity to evaluate whether this very aggressive system of policing and compulsory drug detention system has met its objectives of reducing the availability and use of drugs. And in this analysis, we looked at the immediate, moderate, and delayed availability of 5 commonly used drugs in Bangkok. And as you can see, between 2009 and 2011, the immediate availability of virtually every drug that is used increased quite significantly. We were encouraged to hear that the United Nations, 12 United Nations agencies actually issued a joint statement calling for the immediate closure of all compulsory drug detention centers throughout the world. Unfortunately, this has yet had little impact. So in summary, Thailand's system of compulsory detention seems to have failed to meet its basic objectives. There is still widespread availability and use of drugs. Our data suggests that this system is associated with various forms of police misconduct and violence, elevated risk behavior, and also may be producing interruptions in HIV treatment, although clearly much more work needs to be done to tease apart the effect of this system on health. Also, our data seems to suggest that this system is somehow interacting with access to healthcare by perpetuating stigma and shame and the avoidance of healthcare by a population that desperately needs it. We feel that these findings really point to the fact that the system of compulsory drug detention really should be closed immediately and should be replaced with evidence-based harm reduction and addiction treatment programs if Thailand is to make significant progress in addressing this long-standing epidemic of HIV among people who inject. I'd just like to close by acknowledging the people who participated in this study, our community partners, our research staff and team, and our funders. If you want more information about the Mitsampan Community Research Project, you can find it at these websites, ours and that of the Thai AIDS Treatment Action Group. Thank you.